As we see more hospitals in downtown areas, low-income neighborhoods shut down, are city and state governments moving fast enough to bridge that gap? Joining me now to break this down tonight is Paul Seegert. He's the managing partner of PCS Advisors. Paul, first of all, what accounts for most closures that we see? Is it low demand, low foot traffic, low finances?
Yeah, it really boils down to dollars. Lots of these hospitals, whether we're talking about urban hospitals that are closing or rural hospitals that are closing, have plenty of people that come through the doors that need care. It's just that they tend to serve populations that are covered through Medicare, Medicaid, or are uninsured. And we really have an underlying payment model issue where the reimbursements that they get from these programs are not enough to cover even the cost of care that they provide.
Well, my friend, she actually worked at a similar hospital, and she told me, I never forgot it. She said, we treat patients every single day. They came in. You have to treat them legally. Even if they say, my name is Betty Boop, you know the bill is never going to be paid. They have to pass on the cost to other people, or they just have to take the hit and eat it or write it off or something. Is there a solution to that?
Yeah, you highlight really the problem very well. If the solution historically had been that you would make up for those losses on commercial payers. So if you were in a market where you had enough people that got their coverage at work that were showing up and coming in your doors, then you could afford to lose money on Medicare, Medicaid, and uninsured patients. And we've got a national trend at play that's happening. And then you also have the fact that if you're a rural facility or in an urban, lower income area, a lot of those payers have moved away. And they just simply can't keep their doors open at a loss on each transaction. They need 120, maybe even 140% of what these government programs pay them just to break even.
I know a lot of people automatically go to these greedy hospitals, and it's because a lot of us have had horrible experiences with medical bills. But at the same time, whether the owner is not-for-profit or let's say they're a hedge fund, they cannot be expected to operate at a loss. Is the local government, is the state government responsible? Who steps in?
Yeah, historically it's been these government programs. So it's at the federal level, really, with partnership from the states, that you would set these reimbursements. What we've been seeing is that these reimbursements have been declining. So even as the cost of care has been climbing, these reimbursements have been going down. Medicare, as an example, during 2022 had 2 reductions in these reimbursements to these facilities. And when you look at the big picture and you see that we had 2 out of 3 of us that got our coverage at work 20 years ago, and today less than 50% of us get our coverage at work. It just passed a pretty critical number, 49% of us, which puts an even tighter squeeze, not just on these facilities, but facilities at large. More than half of the hospitals in this country were set to post a loss for 2022. This is part of the reason.
That's depressing because, I mean, a lot of people might feel like, okay, finally Medicaid expanded or CHIP expanded, or, or I'm 65 now. And then now they can't go anywhere and get good coverage, at least, medically, if you're saying that a lot of these places are having to shut down. And we always hear these medical companies say we're short on money, and a lot of us scratch our heads. Should we expect this trend to continue then, that our options are going to continue narrowing?
I think it will, unless we take a close look at how these programs reimburse facilities. It's the same reason that we have 600 rural facilities that are at risk of closing right now. And we lost quite a few through this whole COVID experience, where they were already struggling, and then that was just kind of the final nail in the coffin. And as we see this trend continue, where we're pricing small employers out of offering coverage, and we're pushing more into government programs, then we're going to have to take a close look at those programs and say, are they funded properly? And there's other big macro factors at play. If we could eliminate some of the risk, or not risk, but waste in the cost of care in our system, some of which is unique to our model here in this country. If we can eliminate some of that, then perhaps the funding will be enough. But without that, these folks clearly can't survive.
It's a ball of yarn as big as a city block. No one seems to be able to untangle it, but thanks for helping us kind of understand it a bit. Paul Seegert, managing partner of PCS Advisors. We appreciate